Welcome to the lecture on asepsis and infection control. I love this slide um, after our conversations in class about asepsis. The basics is hand washing. And how would you like to eat a meal that me or anyone cooked without washing their hands? So think about patient care, think about the patients themselves and their need to wash their hands. And that's where infection control starts. It's really not rocket science. It's just what would be the best to prevent any kind of infective process. OSHA has standards for how medical waste should be handled, especially blood-borne pathogens. So a blood-borne pathogen can be anything that could have a blood product on it. So that could be a syringe, it could be a dressing, it could be a splash, anything like that. Anything that could have blood on it or bodily fluids would be considered a blood-borne pathogen. They define 4 principal strategies, including engineering controls, which means what are we doing to prevent a problem in the first place, then adapting it to the workplace, giving people protective equipment, and then universal precautions, which we've already discussed both in clinical and in class. Personal protective equipment, again, you learned all about this in clinical. Start with gloves. That's first one, standard precaution. And then the next one is gloves in a gown, and then gloves, gown, mask, and then glove, gown, and N95 mask. Sharps containers. These are pretty easy to recognize. You can put anything in here that could potentially hurt another person. Now, usually it's used for anything sharp, meaning scalpels, syringes, anything like that. But also, depending on your facility, they dispose of other things in the sharps, but is meant for anything that can cut or pierce the skin of a person. Gloves are always acceptable. You can wear gloves for any reason. I would never ever reach into a patient's bedding without gloves on. I would never give a patient a bath without gloves on. I would never even massage their feet without gloves on, or their back, because you just don't know what's on these people. Gloves can leak though, and organisms can multiply inside gloves. So even though you are wearing gloves, it is absolutely imperative that you wash your hands before and after using gloves. Universal precautions, we've been over this. This protects you from blood, semen, vaginal secretion, cerebral spinal fluid, anything that can ooze out of the patient's body you want to be protected from, and that's what universal precautions are for. Standard precautions are in facilities, and again, a standard precaution would be wearing gloves to do any kind of procedure or touching the patient. Standard precautions means you Sorry about the computer glitch there. Standard precautions means you protect the patient from you and you are protected from the patient. So this applies to blood or any body fluid, non-intact skin, mucous membranes. Always promote hand hygiene, both for you and the patient. Use eye protection when you need to, gowns when appropriate. In this day and age, and don't get hung up on this, but with all the flu and everything, I find masks to be pretty standard. Both patients and staff are wearing masks a lot. Hand hygiene. Don't know how many times I can say this. Obviously, it will be a test question. I'm sure it'll pop up on your boards. Wash your hands before you go into a patient room. Wash your hands when you come out of the patient room. Wash your hands anytime your hands are contaminated while you're in that patient's room. Hand washing involves hand washing with plain soap and water, aseptic hand washing with water and an antiseptic agent, alcohol-based hand rubs. Those are the little things outside all of the rooms. And then surgical hand antisepsis, and that's hand washing before operations or surgical procedures. And that type of hand washing is a bit different. Remember when you can't use an alcohol-based hand rub, and that's mostly for anything that is transmitted by spore, C. diff being the main one. C. diff is not cured by a hand sanitizer. You must wash your hands and push the spores down the drain. Hand rubs, here are some recommended by the CDC. Apply to the palm of the hand, rub vigorously. All of this is based on what the manufacturer says. Hand washing, wash your hands with water. Again, we've tested you off on this, and this is just a review. A lot of this presentation, by the way, is a review for you. Alcohol-based hand rubs require less time. They're more effective for standard hand washing than soap, but that is not if you're dealing with a spore. That's dealing with the main bacteria of life. More accessible sometimes than sinks. They reduce bacterial counts on the hands, and they improve the skin condition. Now, I'm going to probably disagree with this because this would depend on the patient, on the person. Personally, I find hand sanitizers really caustic to my hands. They actually hurt them. So I tend to wash my hands more than use hand sanitizers, but it's totally appropriate to use a hand sanitizer. This is what the Joint Commission is saying. Reduction of healthcare acquired infections, hands washed with soap water before and after every patient contact, or use of alcohol gel. No artificial nails, nail tips, keep nails short and clean. Again, we talked about this in class the other day. No kind of artificial nails are to be worn, including the gel polishes that stay on for a couple of weeks because bacteria can get underneath them. Always protect yourself and other people. Again, can I say wash your hands again? Wear gloves. And wear personal protective equipment. If you're going to be emptying a Foley, if you're going to be emptying a drain, anything you think that could splash on you, you're always willing to wear gloves. There's no rules that say you can't wear gloves or, I'm sorry, a mask or like eyeglasses. I always wear my glasses when I am in the clinical setting. My regular glasses, I think they've protected me from a lot of things, including a broken needle that went shooting up and hit my glasses instead of my eye, which I was very thankful for. But you can wear the plastic protective glasses anytime you feel the need to. Avoid recapping used needles. Obviously, we don't recap used needles. We place them directly in the sharps, or we use the safety device that's on them. When you're cleaning up blood or any body fluid, you always want to wear gloves. You want to discard anything in a red bag and then clean the area with the bleach solution or whatever the hospital recommends or the facility that you work. But anything that has a body fluid on it must be disposed of in the red bags. Again, here's safety caps for you. When we learn injections, I'll teach you how to use the different kinds of safety caps, but just know that they're there. And then this kind of syringe here has its own safety mechanism. After you've taken the syringe out of the patient, you continue to push the plunger and it sucks the needle back in. It's very, very cool. And you'll learn that. We don't have practice ones of those, but you'll learn that kind of injection if you ever give Lovenox. That's a drug that uses that kind of needle, and it really is probably the nicest safety device available. If you're interested in that, you can always look up Lovenox needle safety, and it'll probably have a video for that. Here are some guidelines on handling equipment and articles that are soiled with body fluids. You'll have to prevent skin and mucous membrane exposure. If their clothing's been contaminated, again, I would not touch anything that's been on a patient without gloves on because you never know if they urinated in it, lost control of their bowel, bled. You just never know what you're going to find inside the clothing or the sheets of a patient, so always be very careful. Bloodborne pathogens, here's a few. um, HIV, hepatitis C, malaria, syphilis. They're transmitted when the blood or other infectious materials, that's what OPIM means, comes in contact with mucous membrane or non-intact skin. And they can be, this is the hepatitis B virus, this is hepatitis C. So these viruses can be spread blood to blood. Interesting thing about HIV, the HIV virus, as soon as it hits the air, will die within like 5 seconds. So if someone's HIV positive and they cut their arm and there's blood all over a table, you don't have to worry about it because that virus will die very quickly. Now, I'm not saying you don't have to wear gloves to clean it up. I'm just saying that you don't have to be super crazy about it because the virus actually dies. Hepatitis B virus is prevalent in blood and blood products. It can be transmitted through body fluids such as tears, saliva, or semen. Can be transmitted to the mother, from the mother to the baby during pregnancy. And it can be transmitted from environmental surfaces, and it can live up to a week in dried blood. There's an immunization for hepatitis B, which you've all had, and it's very important, especially for people in healthcare, to have that immunization. OSHA requires it. The hepatitis B vaccine is free to any healthcare worker who may come in contact. It's also free for if you're working in a facility. The facility pays for you to have it before you're employed there. And you can see here, hepatitis B should be made available within 10 working days of initial assignment. I know WellSpan, you have to have your hepatitis B before you can start. Hepatitis C is the most chronic bloodborne infection in the U.S. It's transmitted through large or repeated direct percutaneous exposure from blood. 60% of it is transferred by IV drug use. A needle stick can spread the infection. Obviously, needle sticks are an emergency in the clinical setting or in the when you're working. There's a protocol per facility on what to do with when you've been stuck. Obviously, the first thing you do is wash the area. You clean it very well. You must report it. You must fill out an incident report, and then your facility will require you to have some blood work. HIV is transferred by sexual contact, intercourse with an infected partner, contaminated needles, and blood exposure. It can be transmitted through pregnancy from mother to baby, or through breast milk. They are finding that only 25% of babies born to moms with HIV actually have the virus. So that is all because the placenta is a very good thing. Standard precautions are designed to care for all patients and all clients regardless of their diagnosis or the risk of the infection that they have. If someone is HIV positive, you do not treat them any different than you do any other patient. Blood is blood. Being exposed to it is harmful no matter what the person has. So please don't panic if you take care of an HIV patient. Just wear gloves. Here's how the chain of infection goes. First of all, you have a pathogen. That's the poison. That's the little guy that's causing all the trouble. Then there has to be a reservoir for the pathogen to grow. Then there's a portal of exit, a vehicle, which is means of transportation, and a portal of entry into the second body and a susceptible host. Now, I want you to pause this video now and watch this video on YouTube because it will be quite helpful in understanding the chain of infection. I'm going to end this video now and start another one.